Thank you everyone for joining this webinar. Kevin O'Brien, a nurse practitioner from the National Institutes of Health, will be talking about coping strategies for depression and anxiety. Thank you, Kevin.
Good afternoon, everyone. My name is Kevin O'Brien, and as Belinda said, I'm an NP with the National Institutes of Health. I've been working with the ECD community since 2014, and many of you I already know, and at the last conference, I've met some new faces too. So I look forward to meeting all of you. And a word of thanks to the ECDGA for allowing us to give this talk. So this afternoon, we're going to be talking about two very important challenges that the ECD community faces, and that is anxiety and depression. And this is something that the community has reached out to all of us to say that this is a very important topic for you all. And I've given talks on these topics at the past two conferences, but we would like to continue to spread this message and even get a little more deeply into some of these issues, hence this webinar. So the format of this webinar is going to be a little bit different in that instead of having me lecturing on a series of bullet points on PowerPoint like you see before you, I'm going to talk for about 5 minutes or so, and then we're going to do an interviewer-interviewee format with a member of our community who has faced these challenges. And I think this is going to be a very powerful learning format for all of you to hear from a member of our community. So first, I'm going to start by going over some themes. After our speaker takes over, I'm going to be intermittently chiming in to highlight some important points. After we're done speaking, we will give you time to ask questions. Okay, so to start, as many of you know, that feelings of anxiety and depression are common in when someone is faced with the challenge of having to live with a serious chronic illness like ECD. And I've been told that people will frequently worry about very understandable things like the extent of disability, what their prognosis is, how this is going to change their family life, and how they're going to be able to pay for all of this care. The first thing that we want you to know is that these fears, these concerns, this worry, these are normal feelings in reaction to what actually is an abnormal situation, and that is becoming ill with a serious illness like ECD. And we also want you to know that having these feelings does not mean that you're weak or crazy. Rather, they reaffirm the fact that you're human. And so we want you to be able to talk about these things. There is an important process that takes place that I have seen many times when people are faced with a significant health challenge. And certainly I've seen this in people having to cope with ECD. And that's the idea or the process of becoming overwhelmed by so much change and loss that can occur in some people in a relatively short time frame, as you're going to hear from our speaker, and as some of you have experienced. And there's so much change going on in such a short time period that it overwhelms, that is, it exceeds the person's ability to constructively adapt to what's going on. So some of those feelings, which may start out as what we call a grief response, which many people have experienced over the course of their lives to different things, can evolve into a clinical scenario of anxiety or depression as the person's ability to cope and adapt become overwhelmed. So um, part of the objectives of our talk today is to go further into how this process can take place. What are the signposts? What are the warning signs when a person's grief reaction is now evolving into something more consequential? We're going to talk about maladaptive ways that are often seen when someone is trying to desperately cope with something so overwhelming that they can't get their head wrapped around this. And then we're going to talk about some constructive ways to cope. So we're going to cover that whole gamut in about 45 minutes. So let's start with some of the big challenges that I have seen faced by our community members. First among these is the loss of the, the ability to function physically. Now, many of you know who may have neurologic involvement that it can become difficult to do basic things like being able to dress yourself and bathe yourself, to be able to walk, to be able to feed yourself. But it's not just the neurological issues that can cause this. There are people with ECD who have loss of or impairment of function of their heart or their lungs. And that can also make it very difficult for them to function because they're constantly tired. And then there's the issue of pain, which many people with ECD experience. The pain and what I call the bone crushing fatigue that some people experience. All these things, either separately and certainly together, can lead to a loss of the ability to physically function. This is a big area of loss and challenge. Next, which can be related to that, is job loss. Because of all this change and loss of function, some are not able to maintain their jobs. And with the loss of a job comes loss of greatly needed income. And just as important as that is the loss of health insurance. This creates financial stress, which begins to compound on the physical changes the person is going through. After that, another big area that I see is the loss of a person's sense of self. That is, their sense of self-worth, who they are. You know that in our culture here in the US, we often define ourselves and we show our worth to ourselves and to others. That is based on how we function, what kind of work we do, what our job is, that we're able to earn money, to own a home, and the physical things we do. So when the person can no longer do these things, that can trigger an identity crisis. That now being compounded up on top of the other two things that I've just described can really then set off problems with anxiety and depression. Now, I'm going to skip this slide here. We can talk more about this as Joseph speaks. And I want to get into another very important and sometimes not always addressed issue that can cause mood disorders and mood problems. And that is the loss or change of an important relationship. There's a few things that I want to say about this. Um, whether it's a marriage or an intimate bond with a partner, this relationship is often our most important adult bond throughout our lives. And it is the one person with whom we have the closest connection. And we become to depend on that person, especially when we are ill, and a significant change in that relationship, or even the loss of that relationship, can create tremendous distress, not only in the person who's affected by ECD, but the partner as well. And so I want to make sure that I highlight that some of the issues and symptoms and signs and challenges that we're talking about this afternoon with respect to the person who's affected with ECD also apply to the partner. So this is something that we hear about confidentially, but that I hear about quite often is a major cause, a major trigger for depression and feelings of being anxious in people, because when one is ill, then you depend upon that partner, someone whom you've always come to depend upon. And now, if there's a threat to that relationship, the person may feel that they are losing the one source of support that they need most. I want to say something to our patients here, and that is that please know that as you may be struggling with these feelings with regard to a change in your relationship, so is your partner. They are also, in their own way, having to go through this process too. They have different stresses and demands that are placed on them that you may not be aware of because you're in the weeds, so to speak, of being ill. But we want you to be aware that your partners are also facing many stressors, not the least of which is that sometimes a partner has to become your main caretaker and also has to be the person who now has to support the family. So there can be a dramatic change in both partners. And this is then an opportunity for both the person who's affected with ECD and the partner to come together and talk honestly about what's going on and seek out help. Now, I will be going over some signs and symptoms of what depression and anxiety look like. And our speaker is going to talk about those that he experienced. But as I have done in the past, I want to reemphasize that not everyone exhibits what we would call the textbook classic signs and symptoms of depression or anxiety. Some people may exhibit what we consider to be atypical symptoms. And our speaker is going to mention some of those too. Here, I just want to mention that we expect that when someone is depressed, that they would be melancholic, that is down and sad and blue and may not speak too much. Sometimes someone can have a major depression and have the opposite affect, that is to be very irritable and have a short temper. They may have angry outbursts at times that not that it's not expected. And next, we have difficulty concentrating, which is something, again, that I have seen. For example, you may be at a physician's office and you may be expected to read through a long medical form and check boxes and be able to write. And the person is just not able to do that. They just cannot concentrate long enough to be able to do that because their mind is rushing and just full of thoughts. There are times when a person may not be able to even enjoy a TV show because they simply cannot calm down to be able to sit through the show. Insomnia or lack of ability to sleep is a common sign of depression, but some people have the opposite, which is they sleep too much. And Lastly, I want to point out that overwhelming feelings of guilt and shame, that is, a person cannot stop feeling that they are an unnecessary burden to the family or others, that is an important sign that a person may need help. As we go through the talk, I'm going to highlight some of these things. But as I said, I want to use this new format as a way to uh, bring up these points. So I'm going to switch over to introducing our speaker, Josef Lacy, whom I've known since he enrolled in a trial with us since 2016, so almost a decade now. Uh, Josef is a longtime friend and a great member of our group. So, Josef, I'm going to turn it over to you, and I'll be chiming in intermittently. Thanks.
Hello, everybody. Coming through pretty good. I hope so. Uh, my name is Josef Lacy. I live right outside Kansas City. Um, and I was diagnosed in late 2015. My case was a bit unusual. It was by happenstance. I was in the ER for another issue. They did some scans and immediately um, went, full alert because they thought I had dissected aorta. Of course, I was near panicking, and after transferring me to the main hospital, done a bunch of tests. Um, Somebody there made the suggestion, it turned out to be right, that I had ECD, and they were seeing lesions around my aorta. Um, that uh, uh, the questions about what is this, what's going on, how's this going to affect me? My head was swimming. At first, I was looking up even the wrong definition to another type of disorder, and then I looked up, Ernheim-Chester disease. What's that? And I know every one
Mhm,
of you have heard that. We've
mhm,
all gotten good at explaining it. Um, Everything was kind of up in the air, but my case was different because it wasn't any symptoms that led to my diagnosis. So I was asymptomatic. If that had never been found, I don't know how long it would have taken for them to discover something. It's really unknown. Um, I went on to be part of the drug trial at the NIH where I met Kevin.
right.
Um,
Yep.
Went on a couple of trial medicines, and I didn't respond to them very well. The side effects were too great, and it just didn't leave enough time for any data to be reached or good data to be done. So after so many months, I was taken off the trial, and then I left the CD, but with a ton of information from the multitude of test scans, prods and pricks and everything. Um, that I had, and I kind of went back to my normal life back home in Kansas City. Seeing an oncologist who she didn't know anything about ECD. She kind of learned it along with me, and that's one reason I love her to death because she told me first off that she didn't know what she didn't know. But so I was getting scans periodically, kind of hanging over my head, but since I was asymptomatic and lightly affected, um, thought my life would return to normal, and
Mhm,
that'd be something I just had to, just keep an eye out and monitor.
right.
Living my life normally. I worked for, 20 plus years in restaurants. I managed, bartended, served the whole gamut. And going through life normally. Then in 2021, um, I uh, I had a scan coming up, and I had this scan actually 1 week after a funeral of a good friend who passed away from cancer. So this happened right afterwards, And, just another scan, everything's going to be the same, of course, but it wasn't. And we've all gotten good at reading our own scans, although doctors hate that when we use the patient portal. But we're good enough to read some of the stuff. And I saw that specific area on my PET scan had lit up like a Christmas tree, and it was my prostate. I had aggressive high grade prostate cancer. So in September, I had surgery. Um, and then I want to say a couple months later, I started what's called androgen deprivation therapy. That's basically where they cut off the testosterone to limit the one of the things that prostate cancer feeds on. Same time going through radiation, and at the time I was back to work, so I was juggling that. 2 months of radiation, um, and things were hectic. My life had changed even more, and the difficulties financial with missing work, with my health, things changed. The after effects of that cancer are very problematic with relationships, uh, intimacy, um, and I had just reconnected basically at that celebration of life for my friend with someone who was very special to me, and we've been on and off again, and rekindled that, quite strongly. And I thought this would be the time that would cement that. Um, so during this recovery time, from that, I was really uncertain what was going to happen. I was trying to treat myself right and putting on a good face, but because of these issues, um, I started just feeling like I was losing hope, and but I kept it internal. I hid it very well. Um, I can still do that. I can carry on normal life. I can carry on my routine somehow and separate the two, and
Joseph,
I did.
can I interrupt you there? Because there
Sure.
are some important themes that I would like to bring up.
Yeah.
So just as I described when I was reviewing the slides, we see with Joseph that he's going through a series of changes and loss, big changes. He had an aggressive form of prostate cancer. Then his physical health began to decline from that point. He had a change in relationships. Then he wasn't able to work. So those things that I've listed in the slides, Joseph is experiencing all those one right after the other. So you can see how someone can easily become overwhelmed by this. Then Joseph says something important, which is that he kept these changes, how his response, his psychological response to these changes, he kept them to himself. That is, he avoided saying, hey, I'm really having a lot of trouble here being able to cope with this. And when Joseph and I had talked about this at other times, he would even deny that there was a problem when there was. So this unfortunately can occur, and sometimes it occurs more in men than in women because men are taught to be stoic and stolid and always appear that we have everything under control when that is not the case. So, Joseph, sorry to interrupt you, but I wanted to bring up those points. Please
Yes.
go ahead.
In the beginning of 2022, my oncologist that I saw for the prostate cancer, I mentioned to him that I was starting to have some darker thoughts, and he'd warned me about that with the androgen deprivation therapy, that it can psychologically affect you. So I was actually more aware at that time of how I was thinking, although I think some of my thoughts were from before I even went on the hormone therapy. By actually putting it, in under light. I So I went on a low dose of Effexor for depression,
which is
and
an
it
antidepressant.
yeah, yeah, and it appeared to help at first, but still having issues. The doses changed. Um, the second time I was up to my dosage, I had called and talked to his nurse practitioner because I had had a severe anxiety attack, and I had never had anything like that happen to me in my life. Matter of fact, my in one of my previous jobs, I was in charge of a training team and a lot of pressure, a lot on the line, and I actually thrived under pressure. That was when I did some of my best. And so this feeling of it was like being overwhelmed and almost like a sensory overload. Um, I would it would happen when I was driving the car for work. I would start to just pull on the steering wheel as hard as I could, and almost trying to rip it out of the steering column. I would fidget. I had to get out. I had to escape. I had to go somewhere. Um, I When I heard people talking at work, it drove me insane. And I had to get away. And that happened a couple of times, and it really felt like I thought I was going insane, literally insane, because it was so overwhelming. And it really freaked me out. It was very unusual, and had never had anything like that before. So we upped the dosage again, and so I was still trying to function, but I was also with even my doctors, with my family, and they knew a little bit about what was going on, that I had gone on antidepressant, but I downplayed it big time. Like, oh, this is in the trick. I think this is good. We're fine. I wasn't. I was I was ashamed to admit how much worse it was, because I didn't want to be seen as weak. Didn't want to be um, viewed as uh, something less, of a man, because I'm having these issues, and I'm struggling mightily to deal with them. And everything else. You had the financial, the physical, the emotional, and it was just going around my head. I had these dark thoughts in my head constantly, and they mimicked. They appeared to make sense, and they didn't. And my brain would listen to it, and it was like, I talked to Kevin. We thought of this. I called it a dark logic. Like, oh, it sounds like it's making sense. It's sounding rational, but it was basically the darkness deep down inside me fooling me, and telling me telling me terrible things, and my sense of self-worth, my little bit of pride I had, they they just went down to zero. And I already had a bad self-image, and I realized that later. Ended up to the point where I went to work on a Friday. That was May 8th, 2022, and I asked how odd this behavior was, and I was told that it wasn't super odd, but I felt obligation to go into work and get them going for the day. It was a big day at work always, so like, I'm just going for half a day. But in the back of my mind, I was wanting to end my life, and so I went in. I worked my half day and said, I've got really something important to do at lunch, and they knew with all my appointments and the doctor stuff. They're like, yeah. So I left. I went home and got cleaned up, and then I felt a kind of a weird calm. It was very, very strange. And I kind of you got cleaned up and dressed decent and went out. And I had been formulating plans for killing myself, and went over all the different possibilities. And that dark logic that was like eliminating possibilities, moving ones up. And the odd thing is even though I didn't think anybody really cared, I knew that it would affect some people. So I didn't want like a family member to find me. I didn't want to create like a mess in my apartment. Somebody had to clean that up. And I thought the best way to do this would be take my take my car. It could go fast enough. And I wasn't even thinking I've got two cars. I wasn't even gonna take my nice one because I'm like, I can't destroy that. That's too nice a vehicle. So it's gonna drive my Toyota into a bridge abutment at high speed. And so I left my apartment, got on the highway, and just so happens the hospital I go to is about 5 to 10 minutes away, and it happened to be the path that I took. And as I was driving along, here comes the exit for the hospital, and part of me said, "Pull off, pull off, go up here, and just drive over to the parking lot outside your oncologist's office, and decide if you want to go in and say I'm having some issues." And it took me a few times. I got out of the car twice. I started walking to the office, stopped 2 or 3 times and turned around, then turned back around. I finally made it into my doctor's office and told the receptionist I need to see the doctor. I think she knew something was up. And they got me back to a room pretty quickly. He was on rounds, came very quickly, and came into the office, and and then I cracked. I completely fell apart. I had a complete meltdown. Just everything came out, and I knew I was saying I needed help because I knew that it was due that or that was the end of me. And so
Joseph,
I,
can
I
I interrupt you
yeah,
there?
yeah,
Um, Thank you. First, I want to say thank you so much for being willing to share this very difficult story. We know this is not easy, but we are all very grateful from the bottom of our hearts that you're willing to do this because what you're offering the community is a very powerful testimony of what you went through. But your experience highlights some important themes that I now want to make sure that we review. And so I want to back up and say that Joseph has mentioned twice that there were some pre-existing factors in his life that also contributed to this. So before he became sick, there were some intrapersonal factors in his life that were kind of carried over and unaddressed throughout his life. Now he becomes sick. He becomes ill with EECD, and then he gets prostate cancer. And these issues, which were unaddressed, have a way of um, mushrooming and getting bigger, especially when someone is under great stress, as you just heard. The next thing that I want to point out is that Joseph began this downward spiral because there were certain components that I call the big three drivers of depression and out of control anxiety that Joseph showed and that he's told you about. I'm going to ask him to go into a little bit more here because the opportunity that we have at this webinar is to really dig into these so that as Joseph talks and as I talk, I want you all to be saying to yourself, do I feel like that? Have I felt like that? Am I thinking along those lines too? So that's why we're kind of going into the weeds here. So some of the biggest drivers are number one, um, isolating yourself. And I'm going to have Joseph talk about that a little bit more, but I'll just say from knowing his history that Joseph told me that when, as he was spiraling downward and it was getting harder for him to cope and function, when he made his way through work, when he would come home, instead of doing things that he once liked to do, instead he would come home and buy beer or other spirits and just drink and listen to music or watch TV. So he was isolating himself, and he was using a what we call an unhealthy, or in medical terms would be a maladaptive coping mechanism, which is the abuse of a substance, whether it be alcohol or drugs. And this became the way that he tried to cope with things. So as Joseph and I talked about this, Joseph could very clearly say that he was trying to find a way to escape the overwhelming pain, the uh, the emotional pain that he was feeling at that time. And this is in the twisted and dark logic of depression. The person may decide to use a maladaptive coping mechanism because that's what comes to their mind as being a prudent thing to do. So instead, he turns to alcohol and to drugs some. And as he isolates himself more over time, as he'll explain, including not just after work, but on the weekends too, the isolation then causes you to focus more on yourself and the things that are going wrong in your life. And that's a second driver, which is the person develops an unhealthy occupation with these negative thoughts, just as Joseph said. A medical term for that is called rumination, like the ruminant, the cow that has the two stomachs and the food goes back and forth. It means you're chewing this over and over in your mind, and you become obsessed with these negative outcomes. And then the third piece that you heard him say was that he did not tell someone, he did not admit what his true feelings were or how dark things had become. So those three things, we have isolation, rumination, or an unhealthy um, occupation on these negative thoughts. And then we have the person not coming forth with how they truly feel. These three things, then with Joseph, as you heard, began to put him in that downward spiral. And there's an acceleration now of the symptoms. You heard him describe what his panic attacks were like. So at a time when he's feeling very depressed and very down, he's also experiencing panic attacks. And so, what I want the audience to know is you can have a major depression and at the same time be having panic attacks. And those two things seem like they're the opposite energy states. One is a state of very high energy and being fidgety and not being able to sit down, or your thoughts may race and you may be talking a lot. Whereas in depression, we typically think of someone being slowed down. And yet these two states existed in him. And what I want you to know about that is that these two states start to come together and it starts this vortex, and the person begins to spiral downward as what we heard. Now, the Joseph, I wanted to ask, this was the first serious episode of depression that you had, along with serious anxiety. What were some of the other maladaptive coping mechanisms that you used that ultimately made things worse? Can you
Well,
talk about those?
the isolation for sure. I live by myself, so it was easy for me to hide. Uh, wasn't difficult. Also, downplaying everything. I'm doing well. I could still function, so that was part of the illusion. Um, I actually distanced myself from the ECD community and the prostate cancer community, which I'd gotten involved in, and I just kind of backed away. Like, especially with ECD, I'm like, well, I've been asymptomatic. I'm really not part of that. Didn't feel part, and I isolated myself, and then just by thinking, oh, it's nothing, and there's not a problem so much, and then started thinking about the future I had as far as my physical health goes, and I thought this has been an issue, and I'd just been recovering, and then a few months after that incident, in which I actually spent the weekend in a psychiatric ward, um, getting help because I was going to commit suicide. I was seemingly doing well, but I was still struggling, and just trying to punch through it. And it wasn't too long after that, I started feeling tired. Physical symptoms came up. I dealt with a weird type of vertigo for a bit that couldn't quite be pinpointed. Um, and then I started getting dizzy, losing my balance. My motor skills, my coordination were off. And where I worked at a parts delivery place, in the little warehouse we had, it was a bit of it was a dangerous environment. And I kind of hurt myself a couple of times, falling, tripping, and it got to the point where I was getting so fatigued with my two jobs. I had a nighttime job. I cut back on that bit by bit, and then it got to be earlier in the week when I would just be dead tired, and I was having a hard time functioning at work. I had to stop working, and I was in touch with Kevin O'Brien again after actually being out of touch for a bit. Just like I said, just hiding, and the I didn't know what was going on, but I suspected these were ECD symptoms, and we got some clarification, and it was ECD had become active, and it started my depression, my cycle all over again. I was
Right. Yes.
drinking most nights and getting high.
Mhm.
Really, like I said, not I wasn't enjoying anything I like to do. Um, I lost interest in watching sports and reading. My car is kind of a thing that I always like to tinker with. I lost interest in that, and so every night the only interest was just to sit around uh, in the dark, mostly listen to music, and get drunk or high or both. And that way, just turn everything good. And it would start off first couple of drinks, made me feel good, and I'm like, okay, everything's good. The more I went, it would go downhill, and I'd sink into blubbering mess most nights, and I was ashamed of that. That I would actually end up just crying almost every night and passing out, and it was um I knew that I needed to reach out again for help before I got to the point where I thought I had to end it all. And I'd been down that road, and I I saw help from my good friends and my family, and I've slowly been able to turn it around. I had to stop working, and that was a big blow to my ego, my sense of self-worth, my financially crushed me. We all know the difficulties of getting medical care when the budget's whacked. Um, but I did seek out help again. I speak with a therapist regularly now. I never thought I would be that person. I shocked a lot of people that when I finally came clean about it to more people than my closest group, they a lot of them had zero idea. I hid it very well. I put on a good face. I could joke and laugh, and and on the inside, I was dying. And I really thought that there was nothing worth living for. I was a failure. Nobody wanted me. My relationship dissolved shortly after my stint in the psych ward. I was too much, and part of me kind of understands it. Part of me, my heart's still broken. I can't understand why that happened, and I deal with those feelings all the time still, but I deal with them a lot in a lot more positive manner, and that I've been through a ton and I can get through it. And I actually recognize some of the things I was doing in others, and have reached out to a couple of acquaintances where I could see the signs and let them know, I know what's going on with you. I've been there. Just talk to somebody. If you don't want to talk to me, talk to anybody. Reach out. You have to say something. You have to. Um, if you don't, it's terrible. You just feel more isolated. I didn't think anybody cared. I was very wrong. I was wrong. I was sure nobody gave a damn. Um, and reaching out and then seeking out help was was one of the hardest things I've ever done. It saved my life, and I had so many plans, and a lot of those no longer viable anymore. So I had to change a lot of the way I think, and how do I how do I go on from here? So the uncertainties and are still in the financial things, the physical limitations I have now. I can't do the things I used to do. I have a hard time when I go travel. I have a difficult time and have to use a cane a lot of times because with everybody zipping in and around, it's just hard for me to get around. And I still live alone, but I adopted another dog, and that has been huge for me. Even though I live by myself, I don't feel alone. Also, she gives me um, something greater than me that I think about. When I get to my lowest of points, when still happens occasionally, I know that I've got something greater than me, and that also um, a lot of my friends know that if I give them a call in the middle of the night, they've all said, "We're here. We'll answer. We'll come over." And it's um, the the best support I could have, I guess I can say, and that I actually telling people they wouldn't know otherwise. People don't know how bad things are unless you say something,
Yes.
and you have to. And the movement of the past couple of years to destigmatize mental health has been huge, but it's still got ways to go. And and unfortunately, especially for men, because of the way we're raised. And I still don't like to think about me in that way sometimes, but I've got to be honest, you know, I need help, and I'm going to need it continuously.
Yep.
And I feel it's important to share what I went through so that at least somebody can hear that, trust me, you're not by yourself.
Joseph, I want to make sure I say again, thank you so much for being willing to talk about all of this. What you've just explained is very personal, and many people wouldn't want to talk about that, even to a single other person. And you're doing this for the community as a whole. So we're all very grateful for that. What you've just explained in about the past 10 minutes, there is a lot to unpack there, but and I won't be able to unpack all of it, but there are things that I think are important for the community to know. The first thing is you heard Joseph say that he was put on Effexor, which is an excellent antidepressant and anti-anxiety medication. He was started on a low dose, and the doses of eventually went up until an effective dose was found. And so there's a few things that I want to say there. Number one, a pill by itself is not going to do the job of effectively treating anxiety and depression, especially when you're at the point where Joseph was. You need to do the heavy lifting and the heavy work of talking therapy. That means getting in with the counselor and beginning to identify the fundamental issues that are driving this process or these processes. So it's the combination now of the medication along with the therapy. And with the therapy comes, for example, Joseph, if we had more time, homework assignments that the therapists give you where you learn to interrupt some of those automatic negative thoughts you have. So that's kind of the heavy lifting of mental health that many people don't want to do. They just think that if they take the pill and they swallow that pill, that everything's going to be fine, and it's not. So you see that Joseph goes through a depression. He reaches a crisis point. Thankfully, when he came to that fork in the road, literally and metaphorically, he chose the path of life, which is the correct choice each and every time. And so we want to make sure that we tell you that if you have ever been at this point in your life or you're feeling like that right now, hurting yourself or someone else, which can also occur, is never the right answer. The right answer is to get help. And Joseph is here today to be able to witness that is and was the right choice for him. And then we hear that Joseph has this kind of explosive onset of neuro ECD symptoms, which are now debilitating him more as he's going through chemo and radiation treatment and other treatments for his prostate cancer. He had major surgery for that. So he was dealing with multiple physical challenges all at one time, side effects from treatment. Now he's off balance and is losing his coordination and his voice changes. I was speaking to him during that time. So he's no longer able to work and finances become a big stress. And then there's a very important relationship in his life that is suddenly lost. So he has these hammer blows, one right after the other, which you've heard him explain so well. And so he double dips and he goes down into a second bout of a major depression. And as he told me separately, anxiety attacks. This time, when he dips down the second time, he has learned from the experience that he had the first time. And that is, I need to interrupt this process now because I know where it's going to go. And where it's going to lead to is to the point where, in Joseph's case, he would once again start making plans to end his own life. And with some other people, their feelings get so out of control and their loss of control becomes uh, so severe that instead of violence toward themselves, they may want to act violently toward others. Neither of these choices are the correct choice. So now Joseph goes to get help. He gets into therapy, as he just said. He begins to now wholesale open up and talk to people. And these are the steps that he takes that then begin to help him to get better. Joseph explained to me that one time a friend came over and in his apartment, he had a 30 pack full of beer, right? Joseph and some other spirits in his freezer. And he told his friend, get that out of my house, because he knew that that was an unhealthy way to cope with things. So as he's getting therapy and taking the medication, that dark, twisted logic of depression and then anxiety begins to fade, and he's able to think more clearly again. And he tells his friend, get that out of my house because I know that it's only going to cause me to drink and it's going to cause me to spiral downward again. Now Joseph begins to take constructive steps to help himself. He gets back outside again. He begins to move again. That physical activity is good for you, not just for your body, but it's good for your mind and for your spirit too. He gets a dog, which then allows him now, he begins to take care of someone else, in this case, his dog, and it helps to get him out of that constant negative reinforcement of only occupying your time and your thoughts with bad things, right? And there's someone else to care for, someone to interact with, and that gives him meaning and purpose in his life when he's not able to work. So we can see now Joseph dipping down using maladaptive coping mechanisms. He reaches that trough. This time he's able to act, and then he starts enacting the adaptive coping mechanisms, and he's able to work his way back up. All right. So there was even more that I could unpack there. But we don't have the time. Joseph, I think we've been talking now long enough. I want you to offer the audience any last thoughts that you have, and then we need to open this up for questions.
One thing I realized was that, as you said about hurting yourself, possibly hurting others, when you do that, the pain doesn't go away. It may end for you. You're transferring that pain onto others, um, your loved ones, just other people. Um, and I couldn't do that. And even if I just thought it was just me, there are others that I found out that cared and loved for me, and having them tell me that was very powerful. And um, yeah, and like I said, just speak to somebody, reach out. I believe it's 988 is the 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 emergency hotline to speak with someone, even if it's a stranger. Um, just human interaction is super important. Not being alone and let somebody know how you feel. Trust me. Trust me.
Great. So for any of you out there who may be feeling like Joseph did twice, if you're feeling that way now, what we want you to know is that there is a number, 988. You can call that number. You can text to that number and you can start a chat session with that number. And there are crisis counselors who are available 24/7. The center is never closed. It is a national hotline, and you will be put through to someone who will be able to speak with you. And from that conversation, they will be able to get you to resources. So if you're feeling you're at that point where you may hurt yourself or someone else, we want you to act so that does not happen. Otherwise, what we want you to know is to reach out to your physicians, to trusted family and friends, and truly tell them how you feel. Um, Hope is always there. And as we saw in Joseph's case, regardless of how dark it got, he was able to make things better in his life. So we always want you to maintain a sense of hope. So I'm going to stop talking here and we'll open up the session for questions.
Okay, Kevin, we do have a question and it says, Becky says, thanks for a great talk. Are any members of the community affected by depression and anxiety as side effects of medication?
So that is a great question. What I want the community to know is that yes, some medications can have psychological and psychiatric effects. I'm going to use the example of Joseph having to be on anti-androgen therapy for his prostate cancer. And that's a class of medications which block the production and release of testosterone in a man's testes. It is well known with those drugs that a man can have very strong negative psychological reaction to those drugs because the hormone testosterone in men is not only responsible for our muscles, but it also has tremendous effects on a man's brain and brain function, including mood. I would like to point out that when a man has ECD disease activity in the testes, the disease activity can impair or destroy the health and function of certain cells in the testes that are responsible for the production of the male hormones. And the result of that is essentially the same as taking anti-androgen therapy. And I've seen this in men who have ECD, who, when their testosterone levels plummet, that is actually a hormonal cause of a big change in their mood. So yes, the answer to that is yes. Um, uh, Psychiatric side effects can also occur with chemotherapy agents, and you can have untoward psychological side effects even to some psychotropic medications like antidepressants. That's why it's important that you stay in touch with your doctors, and when you go to appointments, that you tell them how you feel. Thanks for the question.
Thank you, Kevin and Joseph, for a great presentation. This subject is incredibly important and difficult. Your courage and dedication to the ECD community is very evident and appreciated. Please note the ECD Global Alliance resources and contact us if we can be of help. Thank you.